In sports, you were almost used to being quote unquote criticized. You actually became really worried if you weren't getting pointed out all the time because it meant they probably didn't see potential in you. And in medicine, that's been a reality where I'm like, am I going to plateau?
Well, welcome to the Hat Rack. I'm Dr. Bill McCauley. I'm the Associate Dean of Continuing Professional Development at the Schulich School of Medicine and Dentistry in London, Ontario. And we're recording this session in the summertime, summer of 2024, and it's August. And of course, what's going on in the world is the Olympics. Everyone is engrossed in the Olympics. Now, this recording won't be published until later on in the year, but we'll have all fond memories of the Olympics by then. And for the first time in the history of the Hat Rack, we have an Olympian in our studio. We are joined by Dr. Robin Mackin, who's a pediatrician and was on the Canadian Olympic softball team in Beijing in 2008. Welcome to the Hat Rack.
Thank you so much for having me.
Oh, well, it's so great to have you. And we'll just get to what our topic is a little bit later on. But I wonder if you could maybe tell us just a little bit about yourself.
Sure. As you mentioned, I competed in the 2008 Olympics as a softball player and had a career sort of as an elite athlete leading up to medicine, but always knew that I wanted to pursue a career in health professions. It was a really interesting sort of transition, though, from one culture, which I would say athletics and sports, into a totally different profession. And I think part of that lends itself to why I'm so interested in the topic that we're going to talk about today, because I think coaching is a really interesting concept that is extended over so many different domains, but I've experienced it in such different contexts, and it's become such an interest of mine.
Right. So one of the common themes that we have on the Hat Rack is the importance of physicians leaning on each other, relying on each other, learning from each other in terms of helping them to develop their personal, professional skills. And we've reviewed that in a number of different episodes, how important that is. I can't help but imagine that as an elite athlete, that you had to rely on your teammates as well for those sorts of things.
Absolutely. I think one of the interesting parts about being a team athlete is that you become very aware of how every member contributes to this common goal. And I think one of the really interesting things, too, that you learn is that you don't actually have to like all of your teammates, but you need to respect them because you have to sort of understand how each of you sort of contributes to this common goal. And I think that's really important because I think even sometimes in medicine, these might not be people that we would be friends with after sort of work hours, but we definitely need to respect one another and recognize sort of what everyone brings and understand how that sort of helps us get to those common goals that we share.
So I think there's a lot of analogies there between medicine and team sports, and that you're working with colleagues, we are working with peers on a regular basis. But one of the things that you have in sport that we don't typically have in medicine is coaches. Although it's beginning to be a bit of a thing in medicine, it has been for the past 15 or 20 years, it's a bit slow to catch on. So tell us about how you see the parallels in coaching between athletics and the possibility of coaching in medicine.
Yeah, I think it's interesting. I think as I was talking about that socialization process of moving from being an athlete to being a medical learner at the time, one of the things I thought was interesting is kind of the absence of coaching or the absence of that type of investment in you becoming the best version of yourself, right? I think that in sports, yes, it's important to win games and it'd be awesome to win the Olympics. But at the end of the day, medical learners are being prepared to actually contribute to society's health and contribute to advocating for patients and populations. And it almost struck me as sort of funny that I didn't have that same sort of investment just to make sure that I was going to be that best version of myself so that I can be ready for transitioning into that role and being able to contribute the way that I can for society. And I think we've realized that as a profession that perhaps there are ways that we can kind of individualize people's journeys and make sure that we're helping them sort of reach their own personal and professional sort of goals. But operationalizing that is really hard. And I think that's what's made it a bit slow.
There is a great article that I'm sure that you're familiar with that was written by Atul Gawande in the New Yorker magazine in 2011. And he reviews his experience in coaching and basically what he did was to approach a retired colleague of his to come in and actually watch him in the OR and give him some feedback. He also talks a lot about how if you are a professional athlete, he refers to Rafael Nadal in that article, I think, as being at that time one of the best tennis players in the world. Yet he still needed a coach to get better. And he talks about violinists like Itzhak Perlman and classical vocalists, and all of these people who are at the very height of their game still need coaches. They still want to get better to achieve their best. Yet that culture hasn't seemed to have permeated into medicine yet. Why do you think that is?
I think people realize it. I think, like I said, I think it's that operationalization within sort of our profession's culture and the resources that we have. But, I often tell people that what was kind of a jarring experience coming into medicine is that in sports, you're almost used to being quote unquote criticized. At the time I didn't even know what the term feedback was because it was constant, right? And as an athlete and a player, you actually became really worried if you weren't getting pointed out all the time because it meant they probably didn't see potential in you. And so you're primed at such a young age to expect that the coach sort of sees potential in me if they're going to continue to sort of criticize and help me get better and tell me the ways that I need to improve. But in medicine, I almost felt uncomfortable because it was almost like I was taught that you're striving for pats on the back, right? And I always worry, am I going to plateau? Because I realized that I would have never gotten to the international stage of training had I not had coaches or people helping me understand what does that next level look like or helping me achieve what I sort of envisioned for myself. And in medicine, that's been a reality where I'm like, am I going to plateau? How do I seek out these opportunities to understand how I can still continue to move along this trajectory of ongoing growth and development? And I would say more people realize that, especially I think that article brought a lot of attention to that. I think there's still pretty inherent cultural differences between sports, music, and medicine that makes that difficult. But I think it's really important for us to think about how we can actually adopt some of that mindset and some of those supports and structures so that we can actually benefit from it.
Right. We've had a long-standing culture of lack of acceptance of feedback in medicine. And that starts right from early on. So I'd like to talk a little bit about what coaching looks like in medicine. You talked about providing feedback, and as teachers, we do provide feedback to our learners all the time. Is that coaching?
So I think this is such an interesting conversation that I think we could talk hours about if I'm being honest. But when I've sat down and I've really tried to think, how do I help someone understand what's the difference between traditional feedback that we've often experienced in medicine and what's the difference between coaching? And I think one of the first distinctions is when we talk about coaching, a lot of us kind of separate it into two entities. So there's coaching in the moment, so something that's happening in that clinical environment, often following an encounter that someone has observed you doing. And then there's coaching over time. So coaching over time being, conversations that are oriented towards sort of ongoing growth and development. And it may not actually be a reaction to something that coach has actually observed. And so when I think about actually coaching in the moment and how is that different than traditional feedback, there's a few elements that I think are really important. One is that I think the idea is it's oriented towards improvement, whereas sometimes feedback can actually be oriented towards performance. So someone might tell you how your performance compares to what they expect or what the standard is. Whereas when you're having a coaching conversation about that, you're actually focusing it on that individual and orienting it towards how do we help you improve moving from this encounter. So you're not really bringing in all these other sort of standards as to what you would expect from them, but it's honestly about how do we orient this towards your ongoing growth and improvement. The other big difference I find is it's really bi-directional. It's an actual conversation. So, unlike the typical conversation where you might say, how do you think this went? That person sort of tells you, and then you may not actually probe further. You sort of unidirectionally tell them your thoughts on that situation. I think a really good coaching conversation actually can extrapolate some of those reflections, provoke and probe a little bit more to actually together co-construct an ongoing learning goal together that sort of makes sense based off the two experiences that are sort of shared. The other thing that I think is different is in traditional feedback, I would say the feedback provider talks a lot. So they're, kind of telling you, they're advising, they're telling you things. Whereas you'd find that in a lot of coaching conversations, you're asking more. And you'd find that both parties are actually contributing to that conversation a little bit more than some traditional feedback conversations.
It's quite easy as a supervisor to go to the default of a pat on the back and you're doing well and you're doing great job, those sorts of comments. I'm always impressed when a learner is proactive and says to me, well, what can I do different? Is there a way that we can prepare our learners to be more engaged in a coaching interaction in a more a proactive way?
I think that there's so many elements to that. I think there's signals that we can also send as preceptors that learners will pick up on as to what our value system is. And so I think some of those signals are really important to even orient a learner to. So, I'm a hospitalist, so I'll work with learners often at a week at a time. And actually on that Monday, I typically will say to them, the one way that I feel like I can give back to you is to make sure that I can give you sort of good feedback leaving this rotation that you can take and understand how to be better as you sort of move on. And so I want them to know that I will actually intentionally be watching, but I also want to know, is there particular learning goals they're bringing into this rotation that I can actually help support, so it doesn't always feel like they're having sort of start and ends with each learning goal. So I think even having that conversation and prioritizing that early in an interaction helps the learner know that you actually value that a lot. And so perhaps maybe they'll be more responsive to actually engaging, hey, I've never done a newborn exam. It would actually be great if you could kind of watch, and we can talk about that a little bit. I also think, the way that we are prepared to deliver these conversations, when I talk about, asking things, how do you probe? How do you actually provoke reflective thoughts in a learner? Every learner is going to have a different, whether they feel safe to actually reflect with you, whether they actually have those refined skills to do that. But I think there are things that we can do that sort of helps promote that type of behavior in the conversations that we're having.
So this podcast is really directed at physicians or healthcare practitioners who are in practice. How do we encourage coaching interactions for physicians in practice? Is there a world where that can happen, where everyone just expects that they're going to be coached and wants to be coached? How do we get there?
I hope so. I think it would be so valuable, especially after you transition from being a trainee. And, I'm still fairly early in my career. You almost yearn for that opportunity to have someone still, watch what you're doing, helping you understand what you should continue doing and what you should continue to grow. I think there's so many institutional and cultural stigma that is still associated with that. In a study we recently did, one of the probing questions we asked learners was, how would you feel if your preceptor was being coached, right? If you knew that. And it was really interesting because I actually think while we might expect that some of them would say, oh, why do they need to be coached? Like, what is it about them that requires them to be coached? Most of them actually commented on how it modeled the right type of learning attitudes to them. And so I think we have these preconceived notions of what being coached might mean. And I do think it would be great if we can continue to work towards normalizing this concept that all of us have room to get better. It's just that I think we're ingrained in a culture that needs a bit of a shift. And I hope we can adopt that. I hope from the CPD sort of perspective that there's more opportunities to really sort of embrace this idea. And it doesn't even need to be called coaching, but this idea where you actually have some protected, dedicated space by which you can actually reflect on how things are going and have someone work with you to understand, am I still oriented towards ongoing growth and improvement? What does that look like for me? Am I achieving it? Am I accountable to these types of goals? Because I think in a time right now where healthcare is demanding so much of us that we can often not prioritize that for ourselves.
There's a real reluctance for physicians in practice and certainly medical faculty to demonstrate their vulnerabilities to others, right? And so I know in faculty sim sessions, for example, people have been reluctant to volunteer to do that because they're afraid of demonstrating that they might need some work in an area, right? We've had a culture where we achieve nothing but the best and we assume we're at the best and we don't want to show anyone that we're not the best. So how do we overcome that?
It's so interesting, right? I think there's a lot of really interesting research that I've been looking into, and I think it's going to take a slow culture shift, but I think that the key is that it can't just be strategies directed at the individual. We can't just say to that individual, you need to be more growth-minded or open to failures and things of that nature, and then put them in a system that actually reinforces that you should hide your vulnerabilities and things of that nature. So I think we actually have to be intentional about thinking about systemic, institutional sort of things that are happening that are actually reinforcing the types of behaviors that we want. I think as much as most individuals, like if you take them out of medicine and you put them in something totally different, they may exhibit totally different ability to be vulnerable or their willingness to seek feedback or things of that nature. So there is something about the actual, social cultural context that we're putting people in. And I think that's where we need to spend a bit of attention, because I think individuals in medicine, while yes, a lot of us have always sort of seen success and striving for success, I think inherently we all do want to get better.
What about the concept of being coached by a non-physician? So someone might theoretically feel a little bit less vulnerable about showing their weaknesses, I suppose, if they're being coached by someone who doesn't work in your world. Is that a thing? Could that happen?
I think it absolutely could be a thing. I think especially when we're talking about like coaching over time, so someone that's actually going to help have coaching conversations sort of in that longitudinal nature, those people need to be experts in coaching skills. They don't need to be experts in what you're actually doing. They need to be able to actually ask those questions properly and work through the coaching conversations. I think when it comes to coaching in the moment, there's going to be some level of expertise that the person has to have to be able to coach you. What's interesting, I always kind of laugh because in sports, rarely are the best coaches the ones that were excellent athletes, right? But they are excellent coaches and they understand the, mechanics of teams, the mechanics of technical skills related to getting people better. So it's actually its own skill set to be a great coach. And sometimes that very much has nothing to do with being in the same discipline.
I think the other thing is that we tend to have tunnel vision a little bit in terms of what it is that we actually do, right? And there are so many things that we can be coached on, such as communication skills and providing feedback, that someone doesn't need to have the content expertise of our discipline in order to provide us feedback on how we're talking to patients or how we're talking to learners. So I think that's certainly an opportunity for coaching that is perhaps not coming from a colleague.
Absolutely. And I can only imagine how rich and valuable actually having that type of insight and perspective in those moments. So I think that's a really novel thought.
So there are coaching certification programs out there I know you can do. And I think if coaching is going to become a commonplace thing in medicine, I can't see that a lot of physicians are going to go through a complete sort of certification process in coaching. So what in a nutshell would you say someone needs to learn in terms of how to become a coach and the things that they need to do in terms of coaching?
Yeah, I agree. I think, certification is great for maybe a few people who are going to be part of understanding how to train a bunch of people in coaching. But ultimately, I think it comes down to really understanding what are the elements of coaching, what are the actual skills of a coach. And, I think that in itself is such a hard thing actually to learn. But I think actually acknowledging that it's its own skill set. I think in medicine, oftentimes, they say, oh, you're a good clinician, you must be a good leader and you must be a good researcher and you must be that just by virtue of being a good clinician. But we know that's not true, right? So I think similar to coaching, a lot of people might also assume that being a good teacher or being a good mentor means that you would naturally already have that skill set. And while you may naturally learn those skills quickly, it is a different skill set. So I think acknowledging that and just being able to pursue that and really trying to understand what that skill set looks like and being committed to developing it doesn't necessarily need a full certification.
So you already shared with us your thoughts about the differences between feedback and coaching, and you just brought up the term mentor. And a lot of people will use mentor and coaching in the same breath. What do you see as the differences between those two roles?
I think similar to before, we could do a whole sort of session on that. But, one of the things that I've really come to explore with people when I'm talking about is a lot of people sort of understand that there's differences in what a coach brings to the table and what a mentor brings to the table. And we've talked a little bit how a coach doesn't necessarily need to be a content expert and they don't need to have experience necessarily in what you're doing, but they have to be skilled in coaching. If you go to a mentor, they definitely need to be experienced in what you're sort of going for mentorship for. And I think a lot of people understand that, but I think the two things that I often tell people are how I really try to delineate the two is one is recognizing that in a coaching relationship, the coachee is actually the expert. They're the ones who are having the experiences. They're the ones that have been doing whatever it is that they're trying to do. They're the ones that know where they want to go and what that trajectory looks like. And it's really about extrapolating that through sort of reflective questions and things of that nature. The other thing I tell people is I think coaching and mentorship should be thought as different processes. A lot of people make the mistake that, coaching is for academics and mentorship is for career. But I often say no. I think that you can actually go to a coach and a mentor about career, right? Or specialty selection or how you want to advance in your career. But the process of how those conversations are going to happen are very different. And that's why I actually find that I say to people is you probably should think about who's your board of directors, not who are your mentors or who are this, but what does actually your board of directors look like? And typically that should probably have a coach, some mentors, maybe some sponsors as well. But I think it's that process, right? So instead of going to a mentor who's sort of going to share their own experiences, they might probe you a little bit, but they're really sort of helping impart wisdom. In a coaching relationship, they're helping you sort of extrapolate your own experiences, your own thoughts, and orient it to sort of ongoing growth and improvement. So I think it's really a big difference in process.
I like that concept of the board of directors and or a circle of support. And I think many physicians have that, but maybe not deliberately and don't think about it that way. I think being deliberate about looking at what that support system looks like for you, and if there are holes in that circle of support, maybe seeing how you can fill them. I think that's great. Do you think that there is a role for including coaching, the concept of coaching, as part of the undergraduate and postgraduate curriculum? So given the fact that in ChemEd's roles, for example, those are all included in undergraduate curriculum, communicator, professional, scholar. Could coaching be in there somewhere as a key skill that all physicians should have, whether it be for supporting learners as they move forward in their career or whether it be supporting each other?
I think so, right? I think it builds off this idea that we feel that most learners should be learning feedback at one time, right? We were often saying they needed feedback skills. And I think now we're extending that to say, actually, let's teach you a little bit more about this concept of coaching. I think what's really interesting at Schulich right now is that we're actually starting to open up for residents to be coaches for medical students with the intentional purpose of understanding what is it like for them to sort of experience the paradigm on both sides. CBME has essentially brought in coaching at the postgraduate level. And so a lot of them are experiencing it as a coachee, but it'd be really interesting now for them to be sitting as coachees, but then also having a role as a coach, and how does that actually influence both how they interact as a coachee, but also what are they going to be willing to pursue once they sort of graduate, and are they going to feel a bit more confident in these skills?
The other thing that you said earlier on that kind of intrigued me was talking about the importance of the questioning from a coach, and that a coach is not there to just talk at you, but is there to question and pull things out of you. And it reminds me of there being a parallel really between coaching and patient care, because in patient care, really you should be asking open-ended questions and asking lots of questions and allowing the patient to talk and ask questions. Are there parallels, do you think, between those two things?
I think there's definitely parallels, and then I think there's distinctions as well. And I think that's one of the challenges. So in some of our community of practices of coaches here at Schulich, a lot of people will, often compare things like CBD and coaching, and really what are those boundaries to make sure that you're sort of staying within them. And I think that's still an evolving sort of thing to understand. But to be honest, when I recruit for coaching, I often sometimes will recruit people that I know within the nature of their patient-physician interaction, they are probably actually using a lot of coaching skills. And so I think, honestly, learning about coaching and being skilled in coaching is going to help us in so many different ways, whether it's coaching for our peers, adding that skill set within our patient interactions, and certainly interacting with learners as well.
Okay, CBD being competence by design, yes. Right, from the Royal College. Great. So this podcast is called The Hat Rack, and it's called The Hat Rack because we want to give physicians or healthcare practitioners or any listener something to hang their hat on. Are there some things that you think that people should take away from this little chat about coaching, about ways that they could incorporate or think about using coaching in their own practice?
I think one thing to think about to stimulate some, reflection on is kind of what we were talking a little bit about. How can we actually address some of those systemic institutional cultures that maybe is making it harder to operationalize coaching? But I think the practical sort of thing to take away would be just thinking about how can I actually change that next type of, feedback coaching conversation so that I'm making sure it's bi-directional, that I'm asking more than I'm advising, and how do I orient it towards improvement? I think if you can kind of finish an interaction with a learner and ask yourself those 3 questions, that might be a really nice way to sort of understand whether you're moving towards that type of coaching conversation.
Great. Are you still involved in softball?
More in coaching, not
In
playing.
coaching, okay.
Yeah. Once you play a sport that level, I don't know. I've talked to teammates. I'm like, I don't find it as enjoyable to play recreational. I'd rather play like totally different sports.
Okay, I bet you're a great coach. Listen, Dr. Mackin, Robin, thank you very much for joining us today. This has been really interesting.
Thanks so much for having me.
So that was a really interesting session. I think what I took away from that is a couple of things. One is the importance of the questioning and the coaching interaction and making sure that you are changing your feedback sessions when you are working with a learner to be trying to pull information out of them and to try to get them to identify the areas in which they need to improve. I think the other thing that I would like to highlight from this is the importance of us all as a group thinking about changing our culture of acceptance of feedback. I think that most people that have been experienced in coaching on the receiving end, so those coachees, will have received great benefit from that. And if we can all just accept the fact that we can all do a little bit better, we can all get better skills, get different skills, learn how to do things differently by talking to a colleague or a peer or someone who knows our world, then I think that there's an opportunity for us all to improve. And we didn't even talk about this, but I think that these sorts of things as well have been shown to help physicians' well-being. It really has been shown to increase your job and your professional satisfaction. So until next time, thank you for joining us on the Hat Rack, and we'll see you next time.
You've been listening to The Hat Rack, hosted by Dr. Bill McCauley from Continuing Professional Development at Schulich School of Medicine and Dentistry, Western University in London, Ontario, Canada. Technical assistance for The Hat Rack is provided by Patrick Barfoot, Technology Support Specialist at Schulich. Original music was composed by Cameron Bereznik. Please contact us with any questions, comments, or suggestions for future topics or guests. We can be contacted by email at thehatrack@uwo.ca. Additional episode information can be found online at schulich.uwo.ca/CPD. For The Hat Rack, I'm Kimberly Bukala, Educational Developer at Schulich School of Medicine and Dentistry, Western University, leaving you with something to hang your hat on.